I sent it to all our peeps too. So
Welcome to everyone. Glad you're here with us today at the Dementia webinar series. My name's Ashley Varner. I'm one of the clinical social workers here in the Cognitive Neurology program at Emory. I am joined by my colleague, Alice Cooper, and who also works in cognitive neurology, and by Jenny Gay, who is the social worker in the Integrated Memory Care Clinic. We're also very fortunate today to be joined by Ginger Reagans from the Powerline, and I'll give you more details about that in a moment. We, for those who haven't been to our dementia webinar series before, the way that this works is that we will turn things over to Ginger in just a couple of minutes. She'll share what she has to say about Powerline, which is going to be awesome. If you have questions along the way, please put them in the Q&A at the bottom of your screen. And we will have time for questions and answers at the end. We'll finish up about 12:45, between 12:45 and 12:50, and then have time for questions and answers. We will have a hard stop today at 1 o'clock. And Alice, did I forget anything? Okay. So without further ado, I will introduce Ginger. This presentation. Ginger is the Consumer Information Services Manager for Aging and Independence Services with Atlanta's Aging Network. This presentation will provide an overview of the Atlanta Regional Commission's Area Agency on Aging, and give us a really clear glimpse into the workings, including Powerline's Aging and Disability Resource Connection. You might recognize that acronym. It's ADRC. So in this case, it stands for Aging and Disability Resource Connection, not the Alzheimer's Disease Research Center, as it means at Emory. The Aging and Disability Resource Connection helps connect older adults, people with disabilities, caregivers and care partners, and professionals with much needed community resources. And we're going to learn all about the programs and services, as well as some basic eligibility and program processes to help you navigate aging services in the Metro Atlanta area. So without further ado, I'm going to turn it over. And I think you'll be able to share your screen.
All right. Thank you so much, Ashley. Thank you, everyone, for having me today to talk about Powerline. I do want to say a quick little note that I was having some laptop issues earlier. I've already had IT on the scene, so I think I should be good to go. But if for some reason something happens, I'll be right back in. But no, technology has been a joy today. So thank you again for inviting me. So let's do the share screen. Just bear with me. Okay, can everyone see my screen?
No.
Oh.
I cannot.
Okay, let's try it again.
There we go.
Okay. All right, see, I told you, I gave you a quick warning there about technology. But, you know, here at the Atlanta Regional Commission, we have a lot of different names of our departments, but I am in the Area Agency on Aging here at the Regional Commission, and I manage the Aging and Disability Resource Connection. And I'm going to tell you a little bit about what the Aging and Disability Resource Connection is. It serves as kind of like the no wrong door access point. We provide information and assistance to those out in the community who are needing assistance. And it might vary between older adults, persons with disabilities of all ages, families, caregivers, professionals, anyone that is in need of assistance. And We always say that we kind of help those individuals to navigate life changes and surprises, because you never know when you might need some extra resources for long-term support. So the goal of our ADRC is to empower individuals to make informed choices and to provide easier access to long-term support. And you'll notice I said empower, and that's where we got our Powerline. That is the name of our phone number that we have individuals to call in to get services, and we'll talk more about that here in just a minute. But that is our goal. We want to empower individuals with those informed choices. If you do not live in the Atlanta region, you can find an area agency on aging to help you in Georgia by visiting the Division of Aging Services website, or nationwide at usaging.org or the Elder Care Locator. And I have those numbers and the website listed here on the PowerPoint. And I wanted to show you our coverage area. Every region in the state of Georgia is covered by an ADRC, and that is, we serve all, I'm sorry, the ADRC here in Georgia services all 159 counties. But for the Atlanta Regional Commission, we only cover 10 counties, and that is Cherokee, Clayton, Cobb, DeKalb, Douglas, Fayette, Fulton, Gwinnett, Henry, and Rockdale counties. And you'll see by the map that it's kind of broken out by the different area agencies on aging here in Georgia. I know we do have a lot of crossover with Legacy Link. They're the area agency on aging that covers the Georgia Mountain area, as well as Northwest Georgia Area Agency on Aging and Northeast Georgia Area Agency on Aging. So Powerline, that is Atlanta's ADRC, and that is where we are providing information and referral. Oh, and now my computer just blinked out. I'm so sorry. Okay. So that is where we're providing the assistance. We have a proven track record for helping disabled or aging individuals preserve independence and quality of life while staying in their home. We want them to age in place. Here is a list of some of the services we provide through Powerline. We provide information and referral, intake and screening for the Home and Community-Based Services Program. It's a non-Medicaid service, as well as CCSP, which is the Medicaid waiver that falls under the Elderly and Disabled Waiver Program. And we'll talk more about that here in just a minute. And we also provide the BRI Care Consultation Program. It's a caregiver support, telephone support group that helps individuals to care for their loved ones. Assistive Technology, I'm really proud to talk about that. And evidence-based programs. I will share that our call volume has increased significantly since the pandemic, and it's really not eased up. We receive anywhere from 150 to 250 calls a day. So that's a lot of calls, but I am proud to say that we are returning those calls within one business day. So if you ever need any assistance with any services for your clients, just call us here at Powerline, and our number is 404-463-3333, and that'll be on another slide. And here is our website. It's incredible. There's a lot of information listed here, and you can even search for housing, you can search for transportation, financial assistance. There are a lot of resources you can serve your clients yourself if you do not want to call Powerline. We have events on there. There's some senior centers that may have some special games going on. We have regular blogs. There's just so much information on our website. So I just wanted to show you the face page of that, but it's empowerline.org. So do try to take a moment to go and look at that website. And that's also where you can refer individuals, and we'll talk about that here in a little bit as well. So why would someone call the ADRC? Well, our certified information counselors receive over 70,000 requests for information a year. That's a lot. We have an extensive resource database of more than 26,000 services to help link individuals to the supports and resources they need, as well as an extensive partner network able to provide the full suite of home and community-based services to the aging and disability resource community. We provide relevant information designed to help people make informed choices about their long-term care needs, and it's not a one-size-fits-all service. The counselors customize information and resources based on that client need. So it's really important for me to say that it's not a one-size-fits-all. Everybody is going to be different, and that's why our counselors who are certified take that great care with those consumers when they call in. So what are the most common caller requests? Well, some people call in a time of crisis. That seems to be the main focus. Someone may have had their power turned off, a recent hospitalization, a newly diagnosed condition, but others call because they are new to the area and want to see what's available, or they recognize that they or their loved ones are growing older and their needs are changing. We have others who want to engage more in the community and want to know what is available at local senior centers, volunteer, educational, recreational activities. And we all know that in January, when we come back from the holidays, that's going to be our busiest time of year because we find families are in visiting their loved ones and they see, you know, mom might need some extra help. She might need some home delivered meals or an emergency response system. So we're going to be pretty busy come January because those families are going to be reaching out to us for services. So what are the most common requests? Transportation, housing, in-home services, and caregiver support. Those are the most calls that we receive. We also get calls about health and wellness programs, elder law, wanting to know the difference between Medicare and Medicaid, how they can get a better prescription plan, and even private pay resources. So we do help those callers, you know, direct them to the appropriate resource to help them with their need. All right, BRI Care Consultation Program. This was founded by the Benjamin Rose Institute on Aging, and it's a program that serves individuals with memory impairment and their caregivers who assist them with their daily activities, tasks, or health-related disabilities. It's a telephone-based information and support service, and it provides ongoing help to find practical solutions to concerns about health and care. You do not have to leave your home to use care consultation. It's all done on the telephone. And I think that's what makes this program so great because a lot of individuals, you know, they do not have time to leave their home or leave their loved one, but they can always make time for a call. And our care consultants, they have some calls in the morning at 6:30, 7 o'clock, as late as the 7:30 and 8 o'clock in the evening, because we do, you know, understand the caregiver's schedule. And so we do want to be able to provide that support to them. And a lot of times it's just brainstorming, letting that caregiver vent. We're just there. I always say that we're kind of, we're another person on that journey, navigating caregiving, and it's just always nice to have us in their corner. So it is a great program that we offer here. I have 2 BRI care consultants, and they stay pretty busy. Caregiver support's really become popular over the last year, and I think that was because of the pandemic. So many people, you know, exited the nursing home and came home, and their loved ones were not used to caring for them. So I believe that's why caregiver support has really become a hot topic, and we've stayed pretty busy with that caregiver support program. Assistive technology. This is something I'm pretty passionate about. A couple of years ago, I was fortunate to testify in front of the Senate House Committee here in Georgia and request funding for assistive technology for all of the area agencies on aging here in the state of Georgia. And we were allotted $10,000 for each AAA here in the state of Georgia. And that kind of gave us an opportunity to branch out and help individuals with assistive technology, because our goal is to age in place, and we want to age in place in the community and in our home. And assistive technology can do that. To those of you that may not be familiar with assistive technology, it's an item or piece of equipment that can make life easier and make life possible for individuals with disabilities. As aging well advocates, our charge is to empower older adults with the knowledge of assistive technology so they can live at home for as long as possible. I like to suggest assistive technology tools to help, like somebody may call in, caregiver. I'll give an example. They've called in and they are just so tired, and they have a bad back, and they were saying, you know, I just can't seem to get my housekeeping under control. I need to mop, I need to vacuum, I need to do all of these things. And by listening to her concerns, I said, well, let's order you a Roomba. That's one of those vacuum cleaners, the little mobile ones that you just plug and charge it up, and then you can let it go and it'll go vacuum and clean the floor on its own. And she loves that toy. She calls it her toy because she said that's really helped her back. And she knows that she doesn't have to worry about vacuuming and cleaning the floor because she knows the Roomba is going to do it. We've also been able to purchase security cameras for those caregivers who have loved ones that are wandering. We do the door locks, the door alarm. We've also done the Ring doorbell. We've done a couple of GPS trackers. You know, we really try to stay up to date on the latest assistive technology gadgets that are out there. We do work with Georgia Tech Tools for Life on that a lot, but we do try to help those individuals who might have a need, and where we see assistive technology can help them. I mean, after all, you know, the ideas are endless in how we can help someone be independent, because it's very important to us. We even had an individual who had a really bad case of arthritis, and she was unable to open up her spaghetti jar. And so we were able to purchase a Robo Twist jar opener. It was about $18 from Walmart. And it's a gadget that you just sit on top of the jar, press a button, and it opens the jar lid for them. So, I mean, how easy was that? Because she was telling us she was waiting for her family members to come home to open those jars, but now she doesn't have to. So it was just something as simple as an $18 gadget. But our AT specialist here at the ARC is ready to take those calls and help those individuals who might be interested in assistive technology. And for now, we do have some funding, but that could run out. But you know, we do talk to those individuals to see if they might meet the criteria for our assistive technology program. All right, evidence-based programs. These are some great programs. We have workshops on diabetes, chronic disease management, powerful tools for caregivers, and a matter of balance. We just launched Tai Chi, so it's not on my PowerPoint, but these are all programs that are offered. Some of them are free, some of them may be a small fee, but you can call the number there, 470-631-6015 for more information. They'll be glad to talk with you about that and send out any flyers of any workshops that they have scheduled in the area. All right, so one of our most popular services is home and community-based services. And keep in mind, this is the non-Medicaid services. These services are funded with the Older Americans Act. There may be a fee for these services based on a sliding scale. The in-home services consist of home delivered meals, which is pretty popular. Homemaker services consist of housekeeping, personal care, respite care, and case management. It also includes recreation at the senior centers, congregate meals, transportation, home modification, repair services, and adult day program. So it's a whole suite of services that's offered under this non-Medicaid program. But I will say there's typically a wait list because it is county driven, and we'll talk more about that here in just a minute. So what is the eligibility? Well, you have to be 60 years of age or older. Anyone, regardless of age, if they have Alzheimer's. We are serving those most in need, whether it be economic, social, frailty, or at risk of institutionalization. To apply for HCBS services, you'll just call us here at Powerline, 404-463-3333, and we'll determine if you meet criteria via the intake and screening tool. There may be a wait list for services, that's what I was mentioning earlier, because funding varies by county. And as you can imagine, Fulton County is one of the largest counties in Georgia, so they're going to have a longer wait list than maybe somebody in Henry County or Clayton County. So of course, our counselors will talk to them about that. The screening may take about 30 to 45 minutes, but they'll be able to determine if they're eligible and, you know, get them on that wait list and kind of go from there. So the next program that's pretty popular is the Georgia Elderly and Disabled Waiver Program, and that consists of CCSP and SOURCE. Now, we only screen for CCSP. We do not screen for SOURCE. There are other SOURCE intake agencies out there that do that, so we are only doing CCSP. These programs are Medicaid funded. It's community-based care as an alternative to nursing home placement, and it's important for older adults and individuals with disabilities to continue living in their homes and community, and CCSP can certainly do that. So what's the eligibility? Functional impairment caused by physical limitations, Alzheimer's or dementia. You must meet a nursing home level of care, and you must have limited income and resources. Right, so the services that are provided: adult day health, alternative living, which would be a personal care home, emergency response services, respite, home delivered meals, home delivered services, such as the skilled nursing, physical, speech, and occupational therapy, and a home health aide. You know, that's somebody that's going to come in to help with housekeeping, personal care, maybe do some grocery shopping, or to help you to a doctor's appointment. And then there's the structured family caregiving program. So we're going to talk about that on my next slide. This has become a pretty popular program, and it's wonderful. It can help a lot of families. Structured family caregiving is an approved service under the EDWP program, and it provides support to family members who live with and provide 24-hour care for an elderly or disabled family member. The service is provided through health coaches. The service is designed to support those living in with that individual, with their loved one. You have to be living in the home, and those caregivers are unable to work outside of the home because of those caregiver responsibilities. So there's a lot of caveats to that program, and I've got some listed here, and I would love to send this PowerPoint out to you all so you can kind of look at it. But the caregiver, they must be related to the care receiver by blood or marriage. You have to live in the same household with the care receiver under the same roof. You'd be surprised at some of the living arrangements we do hear about. You have to be willing to work with the agency's health coach, and you have to be willing to submit daily care notes electronically. The caregiver may not have any other form of employment, and they cannot be the legal guardian, conservator, spouse, or parent of the care receiver. I know we do get a lot of calls where spouses, are disappointed that they're not eligible for this program. But that is the way the program has been designed. I know there's been a lot of talk of trying to change that, but at this point, spouses are not allowed to be a part of the structured family caregiving program. The care receiver must require 5 hours of direct care daily in order to qualify, and this service is only available through SOURCE and CCSP waivers. We do get a lot of calls for those that are on the Now and Comp waiver or the ICWP waiver, and unfortunately, structured family caregiving is not offered for those waivers. So how do you apply for EDWP? I have a link there. It's found on our website, empowerline.org /CCSP-referral. If anyone is interested in submitting a CCSP referral, you just have to fill out that quick screen for assistance, and a counselor will call that individual and perform a screening assessment. If you do not want to do that, then you can just simply have the client to give us a call at Powerline, and we'd be glad to assist them with that. Typically, the screening takes about 30 to 45 minutes, and the screening just involves answering, a couple of questions about their health, and are they able to do some of the ADLs, and kind of explain their difficulties. We do talk to them about some finances. We ask them about their life insurance. Do they own a home? Because Medicaid estate recovery may come into play if they own a home and it's valued over $25,000. So we do try to help them with that. And another item that I wanted to talk with you about is a research study that we've teamed up with Map Habit on. Map Habit has launched this research study, and it's to promote assistive technology as an effective resource for people with dementia and their care partners by incorporating their app into the participants' day-to-day life. Eligible participants who complete the study will receive $200, an iPad tablet, and a no-cost 1-year subscription to the app. The client can reach out to Brittany Montgomery for more information, and I can send this flyer out, to you, Ashley, to send to your team. But this is a great study. We've been able to kind of test drive it a little bit, and it's just a lot of things where you can go in and play games like Name That Tune, kind of Wheel of Fortune, Jeopardy, that sort of thing. But it works really great for the care receiver and the caregiver to work on together. And of course, the bonus is after the study, you get to keep that iPad. So that's pretty good. But I can send that information out because they are looking for more participants. So that's really all that I have because we do so much, and I just wanted to kind of give you a highlight of some of the most popular things that we have here. And I know we probably will have plenty of time for questions and answers, and I always love that. But I do have my phone number, my email address, and then of course the Powerline website and the phone number. But just to kind of recap, we're the Aging and Disability Resource Connection here at the Atlanta Regional Commission, and we're part of the Area Agency on Aging. And I like to look at it as we're just the front desk for services and resources to aging individuals, individuals with disabilities, caregivers, professionals, anybody that has any questions. I mean, we get calls from individuals to say, I'm aging. I want to know what's out there. What do I have to look forward to? And, we may connect them with some volunteer opportunities, tell them how they can get a home delivered meal if they're eligible. And a lot of times they say, I'm in good health right now, but I might need some help later. Who would I call? Well, I call you back. And we kind of send them a packet out and say, file this away under something very important that you'll remember, and just call us when you're in need of those services. So I know that was a lot of information coming at you.
Thank you so much. That was great, Ginger. And ADRC, the Aging and Disability Resource Center, does so much. And
it is.
It's amazing the resources that are available. One of our attendees said a lot of acronyms were used today.
Yep.
A little bit of alphabet soup.
It is. Yeah.
And said they're new and not familiar. So a couple that they mentioned were CCSP and SOURCE.
Yep. So CCSP, I'm sorry, go ahead.
Go ahead, Ginger.
I was just going to say CCSP means Community Care Services Program, and that falls under EDWP, which is the Elderly and Disabled Waiver Program, and SOURCE is just SOURCE. There's no other words, to describe those letters, but it's just CCSP and SOURCE that fall under the Elderly and Disabled Waiver Program. Those are Medicaid waiver programs that can offer in-home services, but we do not screen for SOURCE. There are other SOURCE intake agencies in the Metro Atlanta region that does that.
And I think, Ginger, correct me if I'm wrong, but I know I've had a couple of clients who called Area Agency on Aging to find out about Community Care Services Program, and they were referred. It was determined that their loved one was a better candidate for SOURCE, and they were referred to somebody. They were referred to the proper place to screen for that.
Right. So SOURCE is for those that are SSI. That's $841. That's the current amount right now. So if we get an individual that calls in and they are on SSI, then we typically will route them to SOURCE because that is the program geared for those individuals. If their income is over $841, they will stay with us for CCSP. But that individual has the choice. If they say, well, I'm already on the phone with you, I'd like to just proceed with CCSP, we will certainly do that.
And the benefits, I believe, are for CCSP and SOURCE are the same.
They are.
Just two different pots of money that the state has.
Exactly.
And I know we introduced yet more alphabet soup. So there is SSI, which is Social Security. Income, and then there's SSDI, which is Social Security Disability Income.
Right.
Disability income is for the is for those who are disabled, and for those who are under 65 and have early onset Alzheimer's disease.
Right.
That is that's an automatic what we call a compassionate allowance. So folks are approved for Social Security disability. SSI falls to those with a very, very low income. So
Right.
less than
And
40.
acute renal failure is another diagnosis that will qualify them for SSDI. Mm-hmm.
So,
Mm-hmm.
There's another question about where can we get a copy of this presentation.
I will send that over to you, Ashley.
That's great. And I'll send it out to folks.
Mm-hmm.
And eventually we are recording it, and eventually it will be up on our website, as long as that's okay with you, Ginger.
Yeah, that's fine.
So that folks can access it. Another question that came in was Alice. Alice, you want to go ahead and ask that directly?
Sure, sorry. So just to clarify, Ginger, when it comes to the home community-based services and the elderly disability waiver programs, when someone calls in not knowing any of it, the Powerline agent will be able to sort through and talk with them about which one they may qualify for. And can you qualify for both, or is it just one, since they're two different?
You could qualify for both, but we will determine what your need is. So when someone calls in, and let's say an individual calls in and they're saying, you know, I live alone. I'm not able to shop for my groceries like I used to. I really need some help with that. And I really need some help with housekeeping. And, you know, we'll kind of start talking to them about the Home and Community-Based Services Program. We'll talk to them about CCSP. We'll even talk to them about private pay resources, because what we find sometimes with that HCBS program, there's a wait list. You know, so that could be 6 months to a year before they come up for those services. And this individual may need that services like yesterday. So the only emergency service that available would be private pay, but so many of our consumers can't afford private pay. So they will elect to go on that wait list for HCBS. If we determine that they may meet the criteria for CCSP, you know, we'll go that route and talk with them about that. But I will say one of the deterrents for CCSP is a cost share. I'm not sure if you're familiar with that, but if a single individual calls in and let's say they make $1,241, well, the limit's $841. So they would be subject to a $400 cost share. And so that individual most likely is going to say, I can't afford that because I'm paying for my rent, my prescriptions, my utilities, my food. So then we're going to backtrack and go back to the HCBS program. So that's, yeah. So our information and referral counselors are trained, certified, and they will walk through all the different scenarios for those individuals to make that informed choice, because there are a lot of choices out there for them.
Ginger, can I switch gears and will you tell us a little more about the Benjamin Rose program? And in particular, I'm really interested. Do you have the same? It's a longitudinal program, so the same care consultant sticks with you. And how often do you get to speak with that care?
Sure. So the program lasts a year. And when we enroll an individual, we will talk with that individual for the first month, probably 2 to 3 times, just to kind of get a feel for what we need to work on. We do kind of like domain maintenance, where we're looking at the dyadic relationship, arranging services, you know, what's the financial assistance and in-home services and things like that. So we'll talk a few times the first month. And then after that, we will talk with them monthly for the first 6 months. Then after 6 months, we will talk with them every 2 months until we're discharging them at the 12th month. So it's kind of like we're with them every month for the first 6 months, and then we kind of take the training wheels off. We have given them the tools that's going to empower them to be that caregiver, and then they're going to try it on their own. But of course, sometimes, you know, we tell them, don't feel like you've got this alone. If we need to put those training wheels back on, we certainly can. Give us a call. We're not telling you don't call us. We're still here for you. But we do find that by 6 months, they're kind of ready to be on their own. And by that time, we may have screened them for HCBS or CCSP, and they may already be on the program at that point. So it's always a joy to us to see how well they do on those programs by having those in-home services.
Fantastic. Thank you.
Yeah.
You.
But it's all about the caregiver. We do talk to the care receiver every once in a while, but this program is just designated, mainly for the caregiver, providing that support. And we do a lot of family mediation, we find, where there may be 4 siblings taking care of their mother, and they all have a different opinion about how to care for them. So we kind of come in and, we're not biased to the situation, and we just try to lay everything out on the table and kind of show them what can help them to get along and to be together to make those decisions.
Well, thank you. Thanks, Ginger. That's much needed, I know.
It is.
Another question that came in is, Forsyth County isn't included in Powerline. Where do we go to find out what resources are available?
So in Forsyth County, you're going to go to Legacy Link, the Area Agency on Aging, and they will be glad to help you there. And you can go to the Division of Aging website and look for Area Agencies on Aging, and you can find their phone number there.
And if I'm not mistaken, the Powerline website does have resources across Georgia.
It does.
So it's a both and, not an either or.
Right. And it's limited, but we always suggest you to call your local Area Agency on Aging, because they have, they have boots on the ground. They may know something that may not be updated in the system.
Excellent. Excellent. That is the last question that we had typed in. Are there any other questions? This is your last chance to get Ginger's attention and get it from the horse's mouth, so to speak.
Right. And while you're all thinking about that, I just want to say, when someone calls in, please know, like I said, we do have a heavy call volume, but our team does return those calls within 24 hours, and we're just talking with them about what is it that they need. A lot of times they start the conversation with, I need affordable housing, I need a meal, my electric bill is past due. What can you do to help me? So we start trying to, we kind of look at it as an onion. We start peeling back the layers, trying to help them, send them a list of housing resources, send them resources to help pay for that utility bill. And then maybe we can order a food box for them and then get them on a wait list for home delivered meals. So, it keeps going on and on for whatever their needs are. We do try to help them. And we do offer private pay, home and community-based services, and the CCSP program. So there are several options there made available to them.
It's amazing what's available.
It is.
I know some of you would like to have these slides. You received an invitation from me, so I think the best way to do this is if you will send me a request for the slides. I will attach them in an email and get them back to you.
And I will also send some brochures of the CCSP program and the BRI program. So I'll send you some other information over as well to back up the presentation.
Great. That would be just fantastic. And also for us to have on hand. We'd really appreciate that.
Right.
And particularly those who are on by phone, I don't have your email, or who don't have who gave a name that I'm not going to be able to figure out what your email is. Please just send me an email and let me know that you'd like the slides if you would. I think.
And please don't hesitate to reach out to me. If you have kind of a complex case and you're like, well, I'm not sure I need to send them to Powerline, but maybe I do, shoot me an email. I'd be glad to help you with that. But I'll tell you, you just can't go wrong with calling our counselors at Powerline. Yeah, they will certainly help.
Any last questions that need to go into the question and answer? Feel free to type them into the Q&A at the bottom.
I see a hand raised, Ashley, but I'm not sure. Ken, are you able to type in the question, or was the hand raised just an accident?
Yeah, you'll need to type it in since we're in the webinar format. All right. I really appreciate everybody being here today. Thank you so much, Ginger. It was fantastic information. Ken, if you do have a question, Alice and I are available to you. And we've got Ginger as backup if we need to reach out. And again, if you would like to get the slides, please send me an email. You have the invitation from me, and I will be glad to get you a copy of the slides from today. Really glad to see everyone. Thanks so much.
And sorry, it went kind of fast.
We're giving folks back another.
I know, we love that.
Awesome thing.
We love
Take
that.
care.
Thank you. I'll get you some things over shortly. All right.
Thank you,
Bye-bye.
Ginger.
Bye-bye.
Bye-bye.